We can all agree that vision is a hugely important part of our daily lives, affecting everything from driving, using computers, hobbies, and so much more. While many people expect changes in their vision as they age, they may not realize that these changes could in fact lead to blindness. Here to talk about a disease that impacts millions of Americans is Dr. Michael Cooney. Dr. Cooney, good morning.
Good morning.
Explain what exactly is wet age-related macular degeneration.
So age-related macular degeneration, or AMD, is the leading cause of vision loss in people over the age of 50 in the United States. So it's a big problem, and it's a rising problem. To understand macular degeneration, you need to understand that the macula is the part of your retina that's responsible for your straight-ahead vision. So seeing faces, reading, watching TV, what most people consider their fine vision. And what happens in macular degeneration is that aging changes begin to accumulate in the macula, which start to weaken it. And those aging changes usually are what's called the dry form of macular degeneration, which is the type everyone starts with and what most people have. However, in about 10% of patients, a more complicated situation can develop, which is wet AMD. And what happens there is a little blood vessel suddenly starts to grow in the macula that can bleed, leak fluid, and cause scarring, and cause a very significant and rapid loss of straight-ahead vision over the course of weeks to months.
And ultimately, this can in fact cause blindness, right?
It can. It causes significant blindness with your straight-ahead vision. It does not affect the side part of the vision, but it causes significant central vision loss if not treated.
Now, do you think a lot of these symptoms maybe get brushed off because people just assume it's eye-related issues due to aging?
I see that on a daily basis in my practice, that people come in thinking, well, I thought I was a cataract doctor, and meanwhile they have macular degeneration. So, a real take-home message here is really that every person over the age of 50 really needs to get in to have a full dilated eye examination on a regular basis to be screened for a host of different age-related conditions, macular degeneration, diabetes, cataract, and glaucoma, because a number of things could be going on that patients are not aware of.
And like we said, vision is part of our daily lives, and I think all of us want to preserve our vision. Are there any ways that we can do that and maybe be proactive in our eye health?
Well, that gets into kind of what are some of the risk factors you can do something about. So we know that cigarette smoking increases your risk 4 times for macular degeneration, so yet another reason to quit, or certainly another reason to not start smoking. Blood pressure control, exercise, weight loss, good nutrition. What I'd like to think about is all the things that are pretty much good for taking care of your heart are good for taking care of your macula. So those are things that people can actually actively do. But there are other things you can't control, such as your age, your genetics. Caucasians have a higher risk factor, as do women.
Anywhere you want to send us online, doctor, to learn more information about good eye health?
There's a great website, www.preventblindness.org, that has a wealth of additional information on this topic, as well as other eye-related issues.
Thank you so much. We certainly appreciate you taking the time to chat with us about it.
My pleasure. Thanks for having me.
For more information on protecting your eye health, head to our website, fox4morningblend.com.